to continue to work towards an AIDS-free society. The Deputy President delivered a keynote address at the main World AIDS Day event in Gamalakhe, near Port Shepstone in the south coast of KwaZulu-Natal, under the theme, Rise, Act and Protect. Now for the latest, we go to our SABC reporter Blain Herman, who is standing by with the Health Minister there. Very good morning to you once again, Blain.
Yeah, a very good morning to you. I was back live from the Ugu Sports and Leisure Centre here in KwaZulu-Natal, Port Shepstone, and it is indeed World AIDS Day 2015. Look, we know the magnitude of the problem. It's huge. We're talking about over 6 million people that are living with HIV in South Africa. We know over 300,000 people newly infected each year. That number works out to roughly about 1,000 new infections per day. It's stark, it's a reality, but we need to confront it. Government is trying to put paid to new infections. There's a number of awareness programs that's taking place, a number of community engagements. I think that's key, community engagements and dialogue, and also an increase in terms of ARV therapy treatment. And then there's the National Strategic Plan on HIV, STIs and TB between 2012 and 2016. That's in place, giving us a sense of where we are at this stage. Let's continue this conversation. Let's further this conversation. Aaron Motswaledi, the Health Minister, joins me now live. Thank you very much indeed for your time, sir. We just heard the Deputy President highlighting where we are, some of the challenges, some of the progress, I guess, we've made over the couple of years. What stood out for you in terms of the speech?
Well, indeed, we have made progress, but he was emphasizing the fact that we're not yet there. Because the progress we are making is largely on biomedical interventions. We have hugely been successful. I mean, the most impactful thing he said, for instance, when he quoted that we have been very successful in prevention of mother-to-child transmission to an extent where we believe that we can actually be a country that can follow the example of Cuba, totally eliminate mother-to-child transmission. Why do we believe that? Because only 10 years ago we had 70,000 new infections every year. That means 70,000 babies born HIV positive every year. Today the figure is below 7,000. Yeah. It's a dramatic improvement. So that is the biomedical. Now what is worrying us is the socio-behavioral interventions. That means the behavior of people to play safe sex, use condoms, make sure that they don't easily get infected. That is the part that is worrying us, because that part is in the hands of individuals, in the manner in which they behave themselves, socially and otherwise.
Well, the social and economic impact of AIDS is huge, isn't it? And let's just talk about the ARV programs. It's one of the largest in the world. But there are some concerns about, can government afford this? It's providing free ARVs for everybody in this country in terms of people that are living with HIV.
You know, I've been asked this question many times and I've got one standard answer. Can we afford not to? Can we afford not to? You can't let so many people get infected and survive socially, economically, politically, and otherwise. So the question we must answer is, can we afford not to put people on treatment? And the answer is always no. We can't afford not to. We have to treat everybody. Otherwise, everything will collapse in the country.
It's a must, isn't it?
It's a must.
Both
HIV, AIDS, and TB is a must. That's why we are running the dual program of 90-90-90 for both TB and HIV and AIDS.
So you confirming money will be found, whatever the case?
We have to. We have got no option. We have to. Remember, when we started this program, which is now massive, in 2009, there were only 923,000 people on ARVs. I was asked the same question. Can we afford to? Today, we are having 3.4 million people on treatment. The same question is being asked, can we afford to? So it will keep on being asked, but we'll keep on moving forward for the simple reason that we've got no option at all.
Yeah, progress indeed. You know, this province, we've got 16.9% of the population that have AIDS. We just reported last month that the 1 millionth person in this province was put on ARVs. You're saying 3.4 million people on the program nationally?
National, yes.
Important.
Exactly. I mean, look at TB. Every one person who's got TB will infect 15 others in their lifetime. Can you afford not to treat that one person? For instance, when we said there's a lot of TB in correctional service facilities, I went to give them gene expert technology. In Paulsmoor, for instance, we even put a small laboratory there for gene expert technology. We put on a unit, a mobile X-ray unit inside the hospital, a digital X-ray, to help them. And they were saying, why do you do this for prisoners? You are not doing it for ordinary citizens. I said, no. If prisoners are carrying a lot of TB and I don't treat them, I'm doing you a disfavor because they will infect you. Because each one has got the capacity to infect 15 others. So if you can't treat one person, you must know you are killing 15 people.
Yeah.
So that's why I'm saying we have got no choice but to make sure that as far as HIV and AIDS and TB programs are concerned, we find the money and we make sure that the programs are implemented.
Minister, I know you're rushing off. Just tell us the program for today. You're visiting a number of wards as well in this area?
Yes, we are going to visit a lot of wards. I understand there are going to be about 23 community meetings that around this area to see what they are doing and encourage them.
Okay.
Yes.
Thank you very much indeed for your time, Minister of Health, Motswaledi. Lots of work to be done here. World AIDS Day really offers us a chance to reflect on some of the challenges that we still need to address and also unite in the fight against HIV. That's how we wrap things up. It's back to the studio.